Thank you for kind introduction. Can you see my screen?
Yes, I
Okay.
can see your screen.
Yeah. First of all, I appreciate the opportunity to speak at this webinar. Today, I'd like to discuss our site-specific conjugation technologies and linker technologies and show you some example of application. First of all, I'd like to introduce our company. This slide illustrates the services we offer to pharmaceutical and biotech company. We have several proprietary manufacturing platforms for various modalities, but since we have limited time today, I'd like to focus on AJICAP site-specific conjugation and linker technology. Yeah. AJICAP technology is composed of two parts. The first is AJICAP conjugation technologies. We can precisely control the DAR number by simple operation without any genetic engineering. And second is novel linker technologies. By using our linker, the resulting ADC increase the plasma stability and hydrophobicity and resistance to neutrophil protease. Our technology enables to prepare a wide variety of antibody conjugate, including ADCs. This slide summarizes the strategy for ideal DAR number depending on payload. The ideal DAR number would be vary depending on the factors such as the potency of payload and tumor sensitivity to payload and modalities. For example, moderate potency payload like exatecan, the ideal DAR number would be more than 4, and current ADC challenges include the heterogeneity caused by stochastic conjugation manner and insufficient efficacy. As for highly potent payload like MMAE and DMR and duocarmycin, the ideal DL number would be 2 to 4. And here is the current challenges of these kind of payload ADC: heterogeneity, insufficient efficacy, and toxicity. As for extremely potent payload like PBD and karicamycin, and new modality format like oligonucleotide, protein, and LNP conjugate, the ideal DL number would be 1 to 2. And the current challenges of this kind of modality and payload, the heterogeneity, toxicity, and stability. To address those challenges, we can solve the we can provide the solutions because we can precisely control DAR number and provide appropriate DAR conjugate for various modalities. By using our technologies, the resulting ADC improves the stability and reducing toxicity. In addition, we can provide the dual payload ADC with various DAR combination shown here, DAR 1 plus 1, 2 plus 2, and 2 plus 8. From this slide, I'd like to explain the AJICAP technology in details. This is the AJICAP reagent. This is our key compound for our conjugation technologies. AJICAP reagent was inspired by FC affinity peptide that has nanomolar binding affinity to FC portion of antibody. Here you can see the co-crystal structure. The FC affinity peptide was close to lysine 248, and Z34C peptide was close to lysine 288. From those observations, we designed AJICAP reagent to modify lysine 248 and 288 respectively. Here is the mechanism of AJICAP site-specific conjugation technologies. AJICAP reagent binds to antibody, and then neighboring amine react with terminal thiol ester to afford antibody peptide conjugate. And then this affinity peptide was cleaved off using hydroxylamine to expose thiol groups. Subsequently, thiol reactive payload is attached to antibody to to obtain site-specific ADCs. We can provide site-specific DAR2 ADC in high yield and low aggregation level, and we have succeeded in 60-gram scale preparation under GMP. And also, we can provide thiol-azyl DBCO intermediate, and also our process is only required TFF operation to remove residual molecule without any chromatography steps. And importantly, FcRn binding and Fc function was retained. This is a summary of our capabilities. AJICAP conjugation technology can be applied to human Ig124 and several types of mouse and rat antibody. And you can choose conjugation site from lysine 248 and 288 and both. And thiol-azyl DBCO group can be attached to antibody. And then you can add the payload, not only small molecule, but also larger sized molecule like protein, peptide, oligonucleotide, and so on. Okay, next, I'd like to talk about our linker technology. Let me start by talking about traditional MCVC Fab linker. This linker is commonly used in ADC field, but there should be two potential issues shown here. The first is instability to a wide variety of protease enzymes, and second is hydrophobicity. Some paper reported that VC linker-based ADC showed faster PK clearance in mice due to instability to CES1C, that is specific enzyme in mice plasma. These results suggested that MCVC linker-based ADC cannot be properly evaluated in mice model in target selection. To address these potential issues, we designed our AJICAP linker shown here. Our linker has hydrophilic peptide and cleavable peptide at the branched position. This hydrophilic peptide increases plasma stability and protects from the undesired enzymatic attack. And also, our linker can be cleaved by cathepsin B and release payload inside the cancer cells, the same as the traditional BC-PAB linker. By using our linker, the resulting ADC improved the stability and good PK profiles. Yeah. By using our technologies, it is possible to achieve a wide variety of DAR conjugate shown here. DR1, DR2, 1 plus 1, 4, 2 plus 2, 8, and 2 plus 8. Today, I'd like to show you the example of AJICAP DAR2 ADC. First, we conducted the efficacy study using AJICAP DAR2 ADC compared to stochastic DAR4 ADC with traditional linker. Here is the result of efficacy study in mice xenograft model. We conducted the same dosage level, 2.5 mg per kg, and we found that AJICAP ADC showed higher efficacy than traditional DAR4 ADC, even if the payload number was half. We also conducted rat tox study and rat tox study in middle and rat PK study in the right. We monitor the body weight changes in rat tox study, and the MTD of AJICAP DAR2 ADC was more than 80 mg per kg. On the other hand, stochastic DAR4 ADC showed toxicity in 40 mg per kg, so MTD of this DAR4 ADC was between 10 mg per kg to 40 mg per kg. This toxicity observation can be explained from rat PK study shown here. In the case of AJICAP DAR2 ADC, total antibody concentration and ADC concentration was almost overlapped, and it means there was almost no payload detachment during circulations. On the other hand, in the case of DAR4 ADC, there was a gap between two concentrations, and it means there was a payload detachment during circulation. This detached payload should cause the toxicity result shown here. Okay, next I'd like to show you application for antibody oligonucleotide conjugate. This slide shows key challenges in AOC development. AOC preparation involved the conjugation of antibody and oligonucleotide, and then purify the AOC from the mixture and formulation. In current AOC development, we consider there are three major challenges shown here. The first is physical property. The standard AOC preparation method is stochastic manner, so the resulting AOC has heterogeneity. Heterogeneous conjugation results in non-uniform physical stability. And second is dose and toxicity. In ADC field, the typical MAD is less than 5 mg per kg. On the other hand, 20 to 60 mg per kg is required in AOC. So higher dose result in on-target and off-target toxicity. So it would be ideal to reduce dosage in AOC field as well. From the manufacturing perspective, DR mixture result in low yield due to separation by chromatography. From those background, uniform conjugation with high yield and efficacy is crucial for AOC development. Regarding the DR number of AOC, there are reports indicating that DR1 is preferable for AOC. And recently, we developed AJICAP DAR1 technologies with affinity peptide shown here. Using our DAR1 reagent, we can only modify the single site of antibody, and we can install the thiol azyl DBCO to antibody without DAR separation. In the case of the preparation of DAR1 AOC, we can provide homogeneous conjugate without DAR separation. In the case of the conventional reduction method, the resulting AOC has heterogeneity and inevitable DAR mixture. It leads to complicated purification and decrease the yield. Here is the graph of the DAR distribution of AOC in crude mixture. AJICAP method achieves over 90% of DR1 species in crude mixture. On the other hand, reduction method has stochastic distribution in crude mixture, so the DAR separation process is needed. We also conducted in vitro knockdown activity comparison between AJICAP and reduction method. The result is shown here. We founded concentration-dependent activity, and AJICAP DAR1 AOC exhibited higher knockdown activity compared to reduction AOC. We also conducted mouse PK study to evaluate the DAR number of AOC. Here is the result, and we found the PK profile was significantly improved in DR1 than DR2 AOC, suggesting that less negative charge of DR1 AOC prolonged in vivo half-life. This is a summary of today's talk. The robust conjugation and linker technology can access to ADCs with various DR conjugate with enhanced in vivo stability and efficacy. It was demonstrated that ADCs prepared using the combination of AJICAP conjugation and linker exhibited more than 8-fold expansion of the therapeutic window compared to traditional ADCs. AJICAP AOC had enhanced in vivo stability and higher in vitro knockdown activity compared to reduction AOC. Yeah. That is my last slide. Thank you for attention.